We have to talk about the coronavirus outbreak that is taking place worldwide. And I know that all week I've been getting emails from people saying, David, when are you going to talk about this? And honestly, what's had me not talk about it so far is that I don't want to be spreading fear and panic about disease outbreaks. And we were really careful back during the highly politicized Ebola situation during the 2014 midterms. I lived in New York City at the time, and there was famously a person who came back from, I don't remember where in West Africa, went to the Brooklyn Bowl near where I lived in Brooklyn, and turned out that he had symptoms, had Ebola, and the term Eboling started showing up on Twitter, and a lot of panic started to spread. And as it turned out, a lot of that Ebola situation was very political. The day after the 2014 midterms, you didn't hear almost a word about the Ebola so-called outbreak. So I want to be careful about not spreading irrational fear and panic. So to begin with, the coronavirus outbreak is an outbreak. It is not a pandemic. That is not the right word to assign to it right now. Coronavirus, this particular coronavirus is known as 2019 nCoV. It is considered a respiratory illness. Initially, it seems as though the source is Wuhan, China. And specifically, it seemed like it was a seafood and meat market in Wuhan, which suggested animal to person spread. That has started to change because there are more and more patients that have had no exposure to animal markets, suggesting person to person transmission. Could be both. Right now, it's just not completely clear based on what the CDC has put out. In general, coronaviruses are coming from animals. They can come from camels, cattle, cats, bats, and some other animals. When it spreads between people, it is often via respiratory droplets, meaning you cough or you sneeze, and there are micro droplets. Someone else breathes them in, or it gets into their membranes in other ways. It's still unclear. Again, a lot of this is still under development, under investigation. Symptoms are typically fever, cough, and shortness of breath. The symptoms sometimes don't appear for 14 days after exposure, which makes this very tricky. But it does mean if you've been in China within the last 2 weeks or around people who came back from China during that time and you have symptoms, you should immediately call your doctor. There have been deaths from this. And we'll get to those numbers in a second. Again, the outbreak centered around Wuhan, China. We actually have a few viewers in that region. Cases have been spreading in terms of countries. You have China, of course, affected, as well as Hong Kong, Macau, Taiwan, Australia, Cambodia, Canada, France, Germany, Japan, Malaysia, Nepal, Sri Lanka, Singapore, Thailand, South Korea, the UAE, the US, and Vietnam. I read this morning in an Argentinian newspaper that there are a couple of cases under observation in Peru. As of right now, it's unclear whether that is or is not this strain of coronavirus. It has reached the United States. As of this morning, there are cases confirmed in Washington State, California, Arizona, and Illinois. 5 patients testing positive in total. By the time you listen to or watch this segment, that number may have increased. No vaccine right now. There are basic prevention measures, hand washing for at least 20 seconds, coughing and sneezing, as I call it, with respect. I am shocked almost daily about the number of adults who seem to either not understand this or not care, walking around, people just coughing into the open air right on top of me on public transit at the grocery store. How do we not know this at this point? Okay. If you are sick, stay home. Difficult when a lot of people can't afford to miss work. I get it. But if you're sick, stay home is the directive. If you're traveling by airplane, you've got to be an adult in terms of the symptoms. Now, the directive is if you feel feverish or have a fever, you've got to tell the airline, you've got to be taken off the flight. Now, I know if you're at the end of a long trip and it's time to get on the plane and you're not feeling well, most people want to get home. Unless it is so acute that you need to go to a hospital right away, most people rationalize, I'll be better off at home than abroad if I'm sick. I don't want to be stuck here. I want to see my doctor. I'll pretend I'm fine. I'm not going to mention my fever. I'm going to get on the plane. I get it. Okay. But we've got to do the right thing because this is going to continue to spread. If you're having symptoms and you are going to your doctor, call ahead. Tell them it's conceivable that you have this. so that they can take the right steps to make sure you don't show up and get other people sick. Wear one of those face masks when you're with other people. And at your doctor's office, you may be asked to wear one. Just do it. If you have pets, and this is important because there does appear to be animal-human contagion here, you've got to try to avoid touching your pets because this can spread from humans to animals. We just don't know everything about it yet. And if you have to have contact with your pets, as most of you do, if you understand the psychology of dogs, it's hard not to be near your dog. You may want to consider wearing one of the masks around your pets as well. So let's work together to stop the spread. Right now, about 7,700 cases worldwide. All but 68 of those are in mainland China. The death toll currently 130. Mostly older folks as of right now. So we're going to be following it. This is not about panicking people, but this is about understanding the risks and the spread and what's going on. I know that the David Pakman Show audience is full of curious and creative people who love learning new things and bettering themselves. And that's why I'm so excited to tell you about one of our sponsors, Skillshare, the vibrant online learning community that offers thousands of classes on almost any topic you can imagine. And you'll get full access to the entire library of classes for 2 entire months free when you go to davidpakman.com/skill. All of the classes are taught by experts in their fields. They've got classes on drawing, painting, photography, video editing, web design, bookkeeping, marketing, personal productivity. Doesn't even scratch the surface. I recently took a class about photography. If anybody follows me on Instagram, you know that my photography skills leave much to be desired. And it was great. I got so much out of it. And hopefully you will see the fruits of me taking that class reflected in my Instagram pictures sooner than later. They have classes for every skill level, whether you're wanting to get better at something you already have experience with, you want to learn something totally new to you. You set your own pace. Classes are usually less than an hour long. They're divided up into bite-sized segments so you can easily fit them into your schedule. Make 2020 a year where you explore new skills, deepen existing passions, get lost in creativity. Skillshare really makes it easier than ever. Skillshare memberships are less than $10 a month, and that gives you access to the thousands of classes they offer. But everybody in the David Pakman Show audience gets a Skillshare membership totally free for 2 whole months. Just go to davidpakman.com/skill. That's davidpakman.com/SKILL.